The large system part's fairly clear, I think, and that's that we have to get all the different players at the different levels, the policymakers, the system managers, and the practitioners, pulling together and working in the same direction. The transformation part is what's less clear, and there isn't a common understanding of what we mean by that piece. I think what we mean is that it has to involve some fundamental reshaping of the way the organization works, whether it's changes in the structures, changes in the incentives, changes in the use of power. The usual way of doing things isn't going to work in a complex system, and we have to reinvent how we do business. For some time now, we've understood a more patient-centered approach to healthcare and the need to really put patient and family at the center, and that how we work with an individual is unique, and that evidence-based guidelines can't tell you how to do that. You have to base that on relationships and the understanding that you have between the people involved. What's new, I think, is an understanding it goes far beyond the doctor-patient relationship, if you want, to include all of the key players in the system. So it's involving interprofessional teams, it's involving the funders, the policymakers. We have to be sensitive to the relationships in all those contexts and get them working, pulling together if we expect to get meaningful transformation. Brenda Zimmerman makes a distinction between buy-in and ownership. And the critical thing is how you create a change strategy that really works with the front line so that they feel it's theirs and it's theirs to make changes with. Another thing that's critical then about this is to come up with measures that really work for the front line, that really add value for their practice, while at the same time provide the system performance feedback so they can see how they're doing, how things are starting to work better, and also provide accountability for the policymakers. The frontline ownership is certainly a part of an effective strategy that needs to be combined with distributed leadership. So it's making everybody in the system feel that they have some role to play in making effective changes and how they need to work together. One of the problems we're running into in Canada is the difficulty in changing the politics around this. As we move into this kind of complexity world, it's very hard to make it simple, it's very hard to make it something that's going to happen fast, and it's hard to get alignment between the political strategy and the kind of practice strategy that's needed to create effective change. Another critical piece is the need for interprofessional teams, teaching people to work together more effectively than they have in the past, a redefining of scopes of practice, a letting go of some of these traditional rules, traditional turf, if you will, so that we can get more collaboration at the delivery stage.